Hi, I'm Brenda, and this is Brenda Chezek Consulting. I'm going to talk about reasons for low number of interview offers. The first reason, and usually the most important or the most common, is board scores are not equal to the specialty that is applied for, or there's board failures. The program directors have the ability to screen in the ARROW system according to board scores. So they may have a cutoff number. They may say, we're not going to look at anybody who's got a board score under 500 or 230, whatever it is. And so you may be screened out universally across all the programs that you apply to if your scores aren't high enough. So if you apply to 100 programs, applying to 200 more is not necessarily going to get you the interviews that you need. What you need to do is look at an alternative. Either look at a different specialty, look at less competitive programs, apply to a TRI at the same location, and see if you can build a relationship with the program director and maybe rotate, maybe apply and get into the program next year. So that's the most common reason. A poor application plan and the wrong number of applications is also an issue. Again, you may put 30 applications out to the most competitive programs in your specialty, and that was it. Or you just did 10 applications. So the NRMP and the AAMC have all the data on statistics on students who matched, and for years in the past, students who matched into which specialty and all their data for you to look at. So you can really look at how many applications you need to put out based on your board scores and figure out what you should be doing. So not listening or not reading the data is a mistake, and not applying to backup specialties is also an issue if your board scores were low or you had failures. So not listening to people around you. Feedback from physicians, faculty, preceptors, if they're telling you you don't quite have the scores for that specialty, you need to really look at yourself and figure out another option or figure out another way that you can get into what you need. If you want to do ortho, but you don't have ortho scores, maybe you can do surgery. Or if you want to do peds and you don't have those scores, maybe you can do family medicine with a pediatric fellowship later on and specialize in that area. Find out from the specialists in the field what the options are. Lack of comments or limited comments on your preceptor comments on your MESP can be another option for why you didn't, or another reason for why you didn't get interviews. People will also recognize that lack of comments can mean that the preceptor didn't want to write something bad, but they're saying it by not putting a comment on. So if you consistently see no comments from 5 different preceptors, there's something there, and the preceptors may read into that. If you have a quiet or shy personality, people can perceive that as maybe conceited or standoffish or maybe not as smart as other people. So you need to push yourself. I know it's uncomfortable. Push yourself to talk and make an effort to let them know who you are. If you have an incomplete application, if you don't have all your LORs or SLOs in, most programs require 4, some require 2 to 3, but if you don't have the number of SLOs or LORs in for the programs that you're applying to, they consider that an incomplete application and won't offer you an interview. So you need to make sure that you're doing your due diligence on all your paperwork and getting it in. And again, if your programs that you applied to were the most competitive programs in your specialty and you don't have the scores for it, then you may want to look at applying to some less competitive programs. So those are some reasons, some common reasons that I've seen for low number of interview offers. And at this point in time, what you need to do is go back and look at your application plan and see if there's any way you can remediate it in order to increase those numbers. I'm Brenda. This is Brenda Chezek Consulting. Subscribe to my channel, and I look forward to seeing you again.